So to finish off this video, I'd like to just go through a little short PowerPoint I've prepared, which is I've called "How to Crash the Global Economy and Gain Financial Control of Almost Everything." And it's just a hypothesis that I had, and it's pretty rough and ready. I've just done it in an hour or so this afternoon, so it's just a few thoughts that I've had on this whole thing based on conversations I've had and things that I've seen. It's not meant to be, a prediction of what will happen. So you can take it how you think. If you think it's a load of rubbish, fair enough. So what do? You pick a time in the winter season in the Northern Hemisphere, and what you do is you start a scare story about a deadly virus in a populated, industrially polluted Chinese city, for example, Wuhan. You hire some folks to put on masks, then faint or fall over in the streets. You make some videos of these stunts and circulate them on social media, so it looks like people are dropping dead from this virus. I mean, these videos might be made in Wuhan, they might be made in another Chinese city, they might be made anywhere in the Far East. You circulate a few stories about a weaponized virus for good measure, and instead of reporting that people are dying of a respiratory illness, you report that they are dying of a new type of flu, and you call this new type of flu COVID-19, coronavirus 19. Now, you can't call it bird flu or swine flu or SARS, as that's already been done. You've got to give it a cryptic sounding coded name to make it sound deadlier, so you get this COVID-19 term into the public consciousness. So what you do is, with this virus, you pick a virus that most people have in their system already, and viruses are basically toxic residue from cells that have been poisoned, and so most people have this coronavirus or something very similar to this already in their system. A high proportion of people have it. Now, then what you do is you design what's called a polymerase chain reaction test, a PCR test, which, if you run this with enough cycles, will show that a high percentage of people can test positive with the virus. They actually have this virus, and your test will show this. So then what you do is, using the unreliable test on as many people as possible, as many you can get away with or get in within a certain time frame, both those that are ill and those that have died, you get this test used on those people. Get all your media contacts to start reporting most or all deaths in this region, say Wuhan or wherever it is, attributed to the deadly, cryptically named COVID-19 virus. And then you ensure that the media keep reporting these awful deaths without reporting the normal death rate for this time of year, nor how the test has been created, nor the number of false positives that the test gives. So you don't tell them anything about the test, you don't tell them that it's not very reliable, you don't tell them what the test is. There's these different types of tests, and you don't tell them what type of test it is. You don't tell them anything, you just say that these people have got this virus and they died of it. Then what you do is, soon after that, you've done that maybe for a few days or a week or something, you get an unelected WHO official, a former communist leader of Ethiopia, actually. I missed that out there on the PowerPoint, but never mind. And he has a PhD in community health studies rather than a medical degree. You get him to declare a pandemic caused by the outbreak of this cryptic COVID-19 virus. And then you get the controlled media in more and more countries to report the bogus test results for more and more people, and get them to report more and more deaths, even though the deaths are mostly just as they would be at any other time in the winter. And then you repeat the previous step in 24/7 media coverage for about another 1 to 2 weeks. And of course, these steps are vital to make the pandemic story fly. Once it seems like enough people are dying from a contagious disease and enough people believe this story, start prodding officials in governments and other bodies to say something must be done. And then you keep reporting high numbers of deaths without explaining this as the normal daily death rate, because typically you might get 1,600 or 2,000 deaths a day in any given country or region, but you just say that that's all down to coronavirus. So you link most or all of the normal deaths in a given region or country to the cryptic COVID-19 virus, and then you ensure that the notion that it is dangerous and contagious are kept in the forefront of people's minds. So you link this idea of a dangerous, contagious virus to the normal deaths. Again, make sure the COVID stories supplant and displace all other stories from the media, such as the ones about high-level paedophile activities, political scandals, Brexit, financial problems, anything really, that you can get rid of all of those stories, largely, just by having this terrible virus that's going to kill everyone. So, step 5 then, now that you have enough people on board with a fake story and with fear and scaremongering, start limiting recreational travel between countries and enforce local quarantine measures to contain this deadly outbreak. Keep reporting increasing deaths from more bogus testing being done on more sickening people. So it's not more people are getting sick really. What you're doing is you're just increasing the number of people that are tested so that you can link these tests to these coronavirus figures. So that makes it then seem like the situation is getting worse. The governments will then look good when they pass stringent measures limiting people's movements in their hometowns and elsewhere to deal with this spread of disease. You then close the schools and the shops again to stop the disease spreading, and this forces a large number of people to give up work and lose their income if you do it for long enough. Then you start talking about a cure for the not deadly virus, and therefore get people thinking that measures need to stay in place until the cure is ready. Get media reports to talk about setting up temporary hospitals for all the victims of the awful virus, and show video of these being built or set up or what have you. Over a period of time, round up some homeless people and take them to these temporary hospitals. But at the same time, you must prevent the showing or circulation of any stories about the normal hospitals from not being full. So you've got to stop these stories about the ordinary hospitals just being basically the same, not being full, they're not overrun. You just want to focus on the stories of these temporary hospitals which you've set up somewhere, and got a few people in them somehow, homeless people or people that have been displaced from other accommodation maybe. By social services. You keep the scare stories going so that people don't ever get wind of the scam. Instead, they just think the draconian measures are protecting them from this terrible virus which is going to kill everyone. After a few more weeks or months, you've managed to collapse most of the global economies, so start to put in place emergency measures to restructure them. Form partnerships between massive global corporations, e.g. retail corporations and governments, to deal with the emergency in various ways, and then get governments to borrow lots of money from the banks or bankers or banksters so that they can give handouts to people who have been financially crushed by the fake pandemic. Additionally, you want to sell all the world's governments your useless virus tests and offer a fake toxic vaccine at a premium cost. Imagine selling 2 billion vaccine shots at $50 a shot and say 2 billion test kits at $20 per test kit. Something like that, just figures I took off the top of my head. Just imagine how much money that would add up to. Start a media campaign about the vaccination for the deadly disease. Say to those that want more handouts, they must have the vaccine. Additionally, pass new laws that allow freedom of movement if they have only if they have taken the vaccination. To stop the future spread of this and similar deadly viruses, after all, it happened once, so it can happen again in the future, of course, implement a tracking system for all people so that authorities will know where everyone is and can fine them for travelling out without permission or without a health certificate or something similar. So, after that, step 9 then, congratulations, in only 2 or 3 years you've gained much control over all the world's governments, economies and people and left them in a broken state of fear, poverty and ignorance. And you've done it, you've achieved your new world order.